Hello, Jasmine. I hope you're doing well. Thanks for allowing me to do your 2D and 3D analysis. So what I'm going to go over today, I'm looking at heating inhibitors, 12 of them to be exact. These can impact your power, contact, as well as your efficiency. And let me pull up the right screen. There we go. And so first thing we're going to look for is what we refer to as sway. All right. And so what we do is we draw a line on the outside of that foot there. And what we don't want to happen is that knee going past that line. So we definitely want a negative move, which is movement away from the pitcher, but we got to be careful about too much sway because that can throw off your timing. You can also lose a little bit of energy. So you can see that knee goes back ever so slightly. And so sometimes the sway is not bad. Sometimes what we call drifting is not bad. But we want to watch out here for this one. You can even see the hips and shoulder getting over there. But mainly we're looking at the knee. And the key thing is we do want to load the knee, but we want to be careful about too much excessive movement away from the picture. All right. Next thing we do is we look at loss of posture. And what we want is when you're going, we want to see you attacking at an attacking angle of your body. And so what we do is we draw a line between your eye and your waist, and we want that line actually facing forward. All right. And then as you go into the toe touch position, we still want you going forward. And you see how you're going back there. And then finally, once you get to heel plant, then at that point, it's okay to be in that position. But the first two positions here should be forward, forward, and then back. I'm kind of exaggerating on the lines, but I just want to show you exactly what we're looking for. All right. And so the question is there physical limitations that could be causing that, or is it just simply um, technique? And you did have a little upper body tightness as well as hip tightness. So that could be contributing to this. But those are things we'll address within the corrective exercises. Next thing we look for is dead hands. And so what we want to see is a little separation of the bat from your body. And so we take you from the negative move, so here. And so what I'm going to do is just draw a little ruler, kind of your hands to your nose. And then I'm going to take you down to the toe touch position. All right. And then we want to see a little separation of the hands to the nose. And I would say yes, um, you do have some separation. You did well on your test, so you're doing the movement screen part. So you do have separation. That's important because that does create that elastic stretch creates energy, and then you can transfer it to the bat. All right. So I'm going to say dead hands, no evidence. The other one we look for is this loss of base. Where's your knee and your heel at toe touch? And so your knee is pointing out over your toe and the back heel is back, so you're good from that. So good base. Next thing we look for is, let me switch that. See if you're hanging back. See if you have appropriate weight shift there. All right, so as you go forward, what we don't want to see is any part of that line, of that foot going behind the line. And so we do negative move all the way to contact. And you can see there's a little bit of that foot going behind the line. Even if let me kind of tweak it out just a little bit here. Even if I put it on that outside foot, if we go, how do we do there? There's a little bit. So that means a little bit of that weight is, not all your weight is transferring forward. And you can actually see as your foot goes, kind of like a pivot. And what we want is we do want you up on those toes, but kind of the tip of your foot. So where you're kind of, if you see one of the golfers, they follow through and their toe is up. Once you make contact, we want that toe up, and after contact, it's okay for the foot to fall back down. So I would say there might be a little weight shift issue going on here. And some of that could be related, yes, to technique, but I also think physically, particularly in your hips, your movement was a little limited as well as your upper body. And I think you're compensating by generating power, you're compensating by trying to keep your weight back. Next thing we look for is what we call gate swing. And what we don't want is for that elbow to get stuck on the hip. All right. And so what we do, if you see the lines on your short, it gets a little blocked out. And so once we get to a certain point, we want to make sure the elbow starts to move past the hip. And so if we go here, a little blocked. So you're getting your arms around, which is good. So no evidence of a gate swing. Other thing we look for is flying elbow. So we get you to toe touch position. We don't want to see that elbow hanging out there. When we take in a little bit more, might have a little bit of a push. So no flying elbow. And all this, what this does is if you have these findings, even though you may get into the correct position later on, you're having to catch up. And when you have to catch up, you're not as efficient as you should. And so when you get to certain positions, everyone kind of has their own swing style, but at certain positions or points within the swing, we expect your body to be in certain position. And so when we get here, so toe touch, elbow, can't see it. But then as we go here, we go a few frames from here to there. And what we still want to see, we don't want to see that elbow flare. All right. We want to pretty much kind of straight up and down. So it lets me know here you're good. Once we get a few frames going, we would like that elbow tucked in a little bit more. Most of your shoulder, your shoulder exam was pretty good. So this may be, you did have a little tightness in the wrist area, but this may be related actually to your pelvis and trunk rotation since they're a little tight. That's probably one of the compensations you're making. Anytime you get that X factor, which is a separation of your upper body from your lower body, many times that elbow will fall into place, but if you don't have that, then it makes it difficult. And we'll see if we can see that on a different view. So I will say you are pushing the ball rather than whipping it. Whipping your hands through. You're pushing it through. And when you whip it, again, you're able to position the bat and make appropriate adjustments. We also look for what we refer to as dumping the barrel. So basically a toe touch. We want that barrel in front of the hands. Another thing we look for is drifting. So I take it to the heel plant position. Let's see it. Yeah. Then I'm going to draw a line, kind of go along that front hip there. And we really want you to rotate around that line, which you do a great job of there. All right. Now I'm going to take it to the rear view. And we're going to see how you do here. Let's zoom, zoom, zoom. And then we're going to take a positive move to contact. So positive move. I'm going to draw a line. Oops. Come back. I want you. We're going to draw a line here. And then what we want to see is your hips not to come off too much on that line. All right. And so as you can see here, and what it means is your hips are getting closer to the base. And so when it happens, you decrease the amount of room you have for your hands to move. And so if someone threw an inside pitch, you would have a little difficult time adjusting to that. And so what we want to see is you rotate around that line. but you see you do create a little space. And actually, we just go to contact. Heel plant to contact, but you can see heel plant to contact, you start coming off that line. All right. And some of that is related to your pelvic rotation, which you do have a little trouble with separating your pelvis from your upper body. Next thing we look for is just casting of the hands. So I'm going to take it to the toe touch position, which are pretty much there. Let me find the toe touch. You want to make sure those hands are inside the elbow or at least in line with it. And then, I'm sorry, I'm going to take you to toe touch first. Toe touch, make sure hands are inside the elbow, heel plant. Hands inside the elbow. You're cutting it close. That's probably, what do you think? You think that's in alignment? Yeah, so you're in alignment. Good. So no evidence of casting of the hands, but we do have a loss of space. All right, and so I'm going to show you your 3D. I think we're going to need to repeat it. X factors, a little bit hard to tell. Sorry, just some of the ladies had a swing style where they really step into it, so they went out of the camera range. And so many times our accuracy on some of this is not good. So we'll have to adjust our cameras to make sure we get you fully in there next time. And sometimes it can throw off the 3D piece, but I think this 3D piece is actually correct. Sometimes it catches it, sometimes it doesn't. And let me see if I can get this to work. So as we go through, what we're looking for is your sequencing. So how are your hips moving compared to your trunk, compared to your shoulders? All right. And so as we get here, let me zoom this in so you can see. So all these little squiggly lines mean something, all right? And so the orange is your pelvis moving, the green is your thorax moving, and the red are is your upper arm, and you kind of say the back moving. So what we want to see is peaks in these, but we want the orange to peak first, then the green, then the red. So in some sense, the red follows the green, but the question is kind of what's the orange doing? We never see like a major peak until afterwards. And so let me zoom out. And so we see it peak kind of after contact, which happens, but leading up to it, we're not getting much firing from your hips. And if you look here, your body is swinging as one unit. And so what we need to do is work on you generating power from your hips. And really what we're saying is your core muscles, and just seeing if we can get we need a peak in this orange, like right in here, and we're not getting that until after you hit the ball, all right? Now, again, with some of this related to the camera, potentially, sometimes all the data we get is incorrect and we have to repeat it. But let's go back to, maybe we can see it on this view. So what we're looking for here, let's go back. Not much of a coil. So if I were to draw a line, and this is not the best because we're not in the 3D, but if I drew a line, I would say your plane is there and your hips maybe just slightly different. And we really want to see a difference in those lines. And so I would say you're turning as a unit and not completely coiling. And so maybe a little coil there, but if you see the plane of your hips and your shoulders, there's not much separation there. All right. And then I'm going to go back to this view. And so what this means is you're kind of all upper body, and we need to engage your lower body a little bit more. And so, of course, you have the lateral movement going forward. And like I said, maybe a little bit of coil there. We'll have to double check that. But as you swing, see how your hips, shoulders, it doesn't appear that you're unwinding. Here, you're kind of throwing that shoulder up and arm up, but your body is moving as a unit. So we want to see a little bit more coil here, generating power and then unleashing that coil. And it fits with your physical screen that we don't see that coiling because we did measure that your thoracic rotation was a little tight as well as your hips were a little tight. And typically what that means is they're going together. All right. So nothing that we can't address. I think doing the corrective exercises, you'll start to see some improvement. I would say for you, really focus. Well, really, obviously, you're going to focus on all of them, but maybe do a little extra, a 2 on the thoracic rotation. Um, and I think that'll help us develop that X factor, which will develop more power within your swing. All right. Appreciate it. Thank you much. Bye bye.